Welcome to the Legacy Education ICD-10-CM Guideline Review Series. I am Tiffany Roach, the coding coach, and I will be walking through the ICD-10-CM guidelines with you. This video will cover the chapter-specific guidelines for Chapter 19, Injury, Poisoning, and certain other consequences of external causes that are represented by codes S00 through T88. This presentation is designed to review the ICD-10-CM guidelines that are effective for both fiscal year 2024 and 2025. There were no changes to the guidelines from fiscal 2024 to 2025. In Chapter 19, most of the codes will have a 7th character requirement. Majority of the codes will have 3 7th character requirements, A, D, or S, but it's important that you check the available list for each code to confirm, especially whenever you have traumatic fractures. The 7th character is assigned based on whether the patient is undergoing active treatment, not whether the provider is seeing patients for the first time. We will go into more detail of the definitions on the next slide. When coding for complications, active treatment refers to treatment for the condition that is described by the code, even when it may be related to an earlier precipitating problem. For example, code S84.50XA for infection and inflammatory reaction due to unspecified internal joint prosthesis initial encounter is used when the infection is being actively treated. It is possible that this can occur even after the prosthetic device, implant, or graft was placed at a previous encounter. As mentioned on the previous slide, the application of 7th characters will depend on whether the patient is undergoing active treatment for the injury. 7th character A should be assigned when the patient is receiving active treatment. This can happen over multiple visits, and it should not be assigned only to the first encounter. Remember, A equals active treatment. 7th character D should be assigned for encounters after the patient has completed active treatment and they are receiving routine care for the condition during the healing or recovery phase. This can also happen for multiple visits. It's important to remember that this is not for use when the patient is receiving active treatment for the injury. And then your 7th character S should be assigned for complications or conditions that are a direct result of a condition. An example of a sequela would be scar formation after a burn has healed. The scar is the sequela of the burn. When using 7th character S, it is necessary to code both the injury code with the 7th character S as well as the sequela itself. The sequela should sequence first, followed by the injury code second. When coding for injuries, separate codes should be assigned for each injury unless there is a combination code available. Codes from category T07 for unspecified multiple injuries should not be assigned in the inpatient setting unless information for a more specific code is not available. Traumatic injury codes S00 through T14 should not be used when a normal healing surgical wound is present or to identify complications of a surgical wound. When multiple wounds are present, the code for the most serious injury should be sequenced first. When superficial injuries, such as abrasions or contusions, are present with a more severe injury of the same site, you should assign only the code for the more severe injury. For example, when you have abrasions or contusions at the site of a fracture, only the fracture should be coded. When an injury results in minor damage to peripheral nerves or blood vessels, the primary injury is sequenced first, followed by the codes for the injuries to the nerves, spinal cord, or blood vessels. If the primary injury is to the blood vessels or nerves, that injury should be sequenced first. Iatrogenic injuries are injuries that occur during or as a result of medical intervention. When these types of injuries are present, a code from Chapter 19 should not be used. Instead, the appropriate complication code should be assigned. When multiple fractures are present, you should sequence the more serious fracture first, as indicated by your medical record. When a fracture is not indicated as open or closed, the coder should default to closed. If a fracture is not indicated as displaced or not displaced, the default should be displaced. Now, let's talk for another moment about initial and subsequent encounters for fractures. Traumatic fractures are coded using the appropriate 7th character for initial encounter for each encounter where the patient is receiving active treatment for the fracture. Initial encounter does not mean first visit only, but rather the fact that the fracture is currently being treated. Initial encounter should also be assigned for a patient who delayed seeking treatment for a fracture or non-union. Subsequent care should be assigned for encounters after the patient has completed active treatment for the fracture and they are receiving routine care for the fracture during the healing phase or the recovery phase. When complications of surgical treatment arise during the healing phase or recovery phase, the appropriate complication code should be assigned. When a malunion or non-union is the result of a fracture, they should be coded with the appropriate 7th character for the subsequent care with malunion, K, M, or N, or subsequent care with malunion, P, Q, or R. When a patient delays seeking treatment for the fracture or non-union and a malunion or non-union is present, you should assign the 7th character for the initial encounter. When a fracture is open, 7th character assignment for the fracture on the forearm, femur, or lower leg are based on the Gastillo open fracture classification. When the fracture is present on any other body part, the 7th character for open fracture type 1 or type 2 should be assigned. These are represented by 7th characters B, E, H, M, and Q. When a patient with known osteoporosis suffers a fracture, a code from category M80 should be assigned instead of a code from chapter 19. This applies even when the patient has a minor fall or trauma, if that fall or trauma would not usually break a normal, healthy bone. The aftercare Z code should not be used for aftercare of a traumatic fracture. The fracture code should be assigned with your appropriate 7th character. As mentioned previously, multiple fractures should be sequenced according to the severity of those fractures. When a physeal fracture is present, you should only assign the code that identifies the type of physeal fracture. No additional codes will be needed to identify the specific bone that is fractured. According to ICD-10-CM, burns are for thermal burns that come from a heat source, such as fire or a hot appliance, as well as burns from electricity and radiation. Corrosions are burns that are due to chemicals. The guidelines are identical for burns and corrosions. Current burns that are represented by codes T20 through T25 are classified by depth and extent, as well as by agent with an X code from the external causes. First-degree burns will cause erythema. Second-degree burns will have blistering. And third degree has full thickness involvement. When burns are present on the eye and internal organs, codes T26 through T28 will be classified by site only, and there is no degree component. When multiple burns are present, the highest degree burn should be coded first. When a patient has both internal and external burns, the circumstances of the admission should govern the selection of the first listed or principal diagnosis. When a patient is admitted for burn injuries, as well as other conditions such as smoke inhalation or respiratory failure, the circumstances of the admission should govern the selection of the first listed or principal diagnosis. When there are burns of different degrees on the same anatomic location, such as same arm or same leg, only the highest degree of the burns should be coded. Burns that are documented as non-healing should be coded as acute current burns. When necrosis of burn skin is present, they should be coded as non-healing acute burns. When any infection of a burn site is present, an additional code should be assigned for the site of the burn. Separate codes for each burn site should be assigned. Category T30 for burn and corrosion, body unspecified, should rarely be used. Codes for burns of multiple sites should only be assigned when the documentation does not specify the individual sites. A code from category T31 or T32 should be assigned when the site of the burn or corrosion is not specified or when additional needs for data is present. These codes should not be used for a sequela of a burn or corrosion, but only for initial and subsequent encounters. You might see the phrase rule of nines used when talking about burns. This will help estimate the body surface involved when exact percentages are not given by the provider. The head and neck are assigned 9%. Each arm is 9%. Each leg is 18%. The anterior trunk, meaning the chest or the abdomen, is 18%. The posterior trunk, also known as the back, is 18%. And then the genitalia are 1%. Together, these total 100% of body surface area. However, these values can change when necessary to accommodate children and individuals who have proportionately larger heads, buttocks, thighs, and abdomens that involve burns. When treating a sequela of a burn, the burn or corrosion should be assigned with the seventh character S. When multiple burns and corrosions are present, they may not heal at the same rate. Sometimes it may be appropriate to code for both a current burn or corrosion, which would be identified by seventh characters A or D, and then a sequela of a burn or corrosion identified by your seventh character S when both are present. When the information is provided on the source, intention, or place of occurrence for the burn or corrosion, then you should assign as many external cause codes as necessary. Codes found in categories T36 through T65 are combination codes indicating the substance that was taken as well as the intent. It is not necessary to also code an external cause code. It is important to understand that you should never code directly from the table of drugs and chemicals, and you should always verify the code in your tabular list. You should use as many codes as necessary to describe all drugs, medicinal, or biological substances. And if multiple medications map to the same ICD-10-CM code, you should only assign the code once. When multiple drugs are taken, you should code each of them individually, unless there is a combination code available. And if multiple unspecified drugs, medicinal, or biological substances were ingested, you should assign the appropriate code from category T50.91. When coding for the adverse effect of a drug that was taken and prescribed correctly, you should assign the appropriate code for the nature of the adverse effect, followed by a code for the adverse effect itself. The code for the drug should have a fifth or sixth character of 5, indicating an adverse effect of the drug is present. Some examples of adverse effects are tachycardia, delirium, GI hemorrhaging, vomiting, hypokalemia, hepatitis, renal failure, and acute respiratory failure. When coding a poisoning or reaction to the improper use of a medication, the first code should be from categories T36 through T50. The fifth or sixth character should correlate with the intent, such as accidental, intentional self-harm, assault, or undetermined intent. If the intent is unknown or unspecified within the medical record, the intent should be coded as accidental. The undetermined intent should only be used if the documentation in the record specifies that the intent cannot be determined. If any manifestations are present of the poisoning, those should be coded as well. If there is documentation of abuse or dependence of the substance, then the abuse or dependence should also be assigned. Some examples of poisoning can include the following: any errors made in prescribing or administering a drug, overdosing of a drug that was intentional, When non-prescribed drugs are taken in combination with a correctly prescribed and properly administered drug, or a reaction that results from the interaction of a drug and alcohol. When the term underdosing is used, it simply means that the medication is prescribed correctly, but the patient takes less than what is prescribed. When the patient discontinues the medication when not instructed by the provider, this will also classify as an underdosing. Documentation of either situation is sufficient to code for an underdosing. Your underdosing is coded with categories T36 through T50 with a fifth or sixth character of 6. Codes for underdosing should never be reported as your first listed code. It should instead follow a code for the condition which prompted the prescription. If the intent is documented of the underdosing, then the non-compliance or complication of care can be reported separately. A toxic effect is when a harmful substance is ingested or comes in contact with a person. These toxic effects should be coded with categories T51 through T65, followed by a code for the manifestations that are a result of the substance. The toxic effect codes have an intent component, such as accidental, intentional self-harm, and undetermined. When adult or child abuse, neglect, or maltreatment are documented within the record, you should assign the codes as follows. If confirmed, a code from category T74, followed by an external cause code for the assault, found in categories X92 through Y09. When the perpetrator of the abuse is known, you should also use a code from category Y07. If it is suspected, then you should use a code from category T76. These codes should be followed by any accompanying mental health or injury codes that are also present. And then when a case of abuse, neglect, or mistreatment is ruled out during an encounter, either Z04.71 or Z04.72 should be used. If a suspected case of rape or sexual abuse is ruled out during an encounter, either code Z04.41 or Z04.42 should be assigned. If suspected forced sexual or forced labor exploitation is ruled out during an encounter, code Z04.81 or Z04.82 should be assigned. In either of these circumstances, category T76 should not be assigned. When coding for the complications of care, you should see subsection B16 for instructions. When pain that is associated with devices, implants, or grafts that are left in a surgical site, you should use the appropriate code from Chapter 19. Specific codes for pain due to these medical devices are found in categories T82 through T85. When acute or chronic pain is present, a code from category G89 can also be used. When a patient undergoes a kidney transplant, they may still have some form of chronic kidney disease because the transplant may not fully restore kidney function. For patients with CKD following a kidney transplant and no complication is present, you should see Chapter 14 guidelines for further instruction. When a combination of the transplant is present, such as failure or rejection, a code from category T86.1 should be assigned. If the documentation is unclear as to whether the patient has a complication of the transplant, you should query the provider. When a complication code is used in Chapter 19 that includes the nature of the complication, as well as the type of procedure that caused the complication, it is not necessary to use an additional cause code to indicate the type of procedure that caused the complication. Intraoperative and post-procedural complication codes can be found within the body system chapters with the codes that are specific to the organ or structure of that body system. These codes should be sequenced first and followed by the codes for the specific complication, if appropriate. These complication codes within the body system should be assigned. For example, Chapter 9 for a vascular intraoperative or post-procedural complication unless the alphabetic index indexes the complication to a T code within Chapter 19. As always, thank you for supporting us and stay tuned for new videos in our ICD-10-CM guideline review. Please make sure to subscribe to our channel so that you can be in the know of our newest videos as they are released.